Our multicellular parasites are going to be what most people would call worms. The first group that we'll discuss are the nematodes. These are large cylindrical worms that are sometimes also called roundworms. They are unsegmented, so unlike maybe an earthworm or something, they're pretty smooth, and adult worms are often found in the intestines. There are a number of different species of nematodes that cause human disease. We can't possibly talk about all of them. Not all of them are relevant to us in the States, but some that you probably have heard of. Dog heartworm is a type of roundworm or nematode. We've got pinworm, the disease that we call roundworm, infections in dogs, cats, raccoons, hookworm. So lots of things that can affect people and animals. The first one we're going to talk about is Enterobius vermicularis, which is pinworm. Again, I'm not going to ask you about all of the different life stages, even though this one is actually pretty straightforward. Humans, because we'll talk about humans, will ingest eggs. So it's a fecal oral transmission. The egg is the infective stage of the parasite. The eggs will hatch, larvae will move to the large intestine and mature into adults. Male and female of the nematodes generally look different. There are two sexes. Then eggs will be found around the anus. So this is person-to-person spread. It is seen often in daycares, schools, mental institutions, places where people may not have the best hygiene, either because they haven't learned or because they have developmental disabilities that prevent them from having the appropriate hygiene. There are an estimated 500 million cases annually, and this again is a fecal oral infection, and it is possible to maintain your own infection through autoinfection. Patients can be allergic to the worm's secretions and experience a loss of sleep and severe itching, and the scratching can lead to bacterial infections. Generally, the worms emerge at night and lay their eggs around the anus, which is what wakes people up because it itches and it bothers them. Worms can migrate to the vagina or urethra and cause other issues, and sometimes they can cause inflammation and granulomas in the bowel. It's relatively easy to diagnose the infection. If you have children, you'll notice them itching their bottoms quite frequently. You will do a sticky swab of the area, like clear tape, and you can find the eggs and sometimes even the worms if they get stuck on it when they come out at night. There are treatments available, some of the classic antiparasitics. Generally, the entire family should be treated because if one person has it, probably everybody has it. And of course, increased personal hygiene. So again, because this is relatively common in children, you want to encourage your children to always wash their hands, to not put things in their mouths that other people might have touched. That's how it can spread around daycares and things like that. The next nematode we'll discuss is Ascaris lumbricoides. Sometimes people just call it Ascaris or they'll call it roundworm. Again, there are the different life stages. Patients will ingest an egg. That's the infectious stage. The larvae will migrate in the body till they get to the intestines. Adults will develop in the lumen of the intestine. Again, there are separate sexes, male and female. The female is generally much larger. The eggs can be found in the feces. That's a diagnostic stage. Sometimes adult worms will also be shed in the feces, so that can be diagnostic. And then after the eggs are shed in the feces, the eggs continue to develop until they're ready to be ingested again. So a single female roundworm can lay up to 200,000 eggs per day for a year. Eggs can be found 60 to 75 days after infection. So that's about how long it takes them to mature, to mate, and to lay their eggs. And the eggs can remain infectious up to even 2 weeks. After 2 weeks in the soil. So remember I said we have to have some dividing occur in the eggs. So that takes about 2 weeks or so for the eggs to become infectious. and then they can remain infectious for a while after that. This particular roundworm is common in areas that have poor sanitation, and also in areas that have used human feces as fertilizer. Sometimes they call it night soil, so it is not recommended to do that. This is the most common helminth infection worldwide and estimated to infect approximately 1 billion people. It is more dangerous to ingest an adult than it is to ingest the eggs. The adults can migrate into the bile duct and liver. They can perforate the intestines and create infection in the regions surrounding the intestines, the peritoneum. When you have a massive infection, lots of adults in the gut, a tangled bunch of worms can actually block the intestines. Examination of the stool will generally show eggs. Sometimes you may find worms, not as common. However, treatment with some of the antiparasitics are going to help get rid of the infection. And eggs can persist in the soil for up to 3 years. I don't know why it says day there, but up to 3 years. What you see in this picture here, this is actually a mass of Ascaris that were found in the stomach of an infant. And of course, that infant died because this mass of roundworms was blocking their stomach. So it can be a very massive infection. Our next roundworm or nematode is Trichinella spiralis. This is sometimes called porkworm. It is not a tapeworm. We will talk about a pork tapeworm, but this is a different kind of worm that we generally would get from eating undercooked pork. So if we look at the pig, the larvae are in the muscle. They're encysted in the muscle, kind of like this. This is an actual diagram of it. And so that can be consumed, and if it is consumed, the larvae will be released in the small intestine. They'll mature into adults, have more larvae. The larvae will go into circulation and go into the muscles. And so what you would see in patients is actually the larval form found in the striated muscle of humans as well. So normally, like in pigs, the larval form goes into the muscle with the hope, I guess as much as a parasite can hope, with the hope that the parasite would be consumed by a predator. And then the larvae will get to mature into adults and lay their eggs. So humans are sort of a dead end because, again, we are not often consumed by predators. But the infectious larval form can be found in all sorts of different striated muscles. The infection occurs worldwide, again, mainly associated with the consumption of pork. An estimated 1.5 million patients infected in the US, with between 150 and 300,000 that acquire the infection annually. And most patients will really never know they have the infection. As long as there are fewer than 10 larvae per gram of muscle tissue, the patient will remain asymptomatic. Patients who have more than 100 will have significant disease. They'll feel it. Anywhere from 1,000 to 5,000 larvae per gram of tissue, that can be fatal. Depending on which muscles these go to, if you get things like inflammation of the heart, inflammation of the brain, inflammation in the lungs, destruction of the diaphragm, that can also cause fatal infection. Diagnosis of trichinellosis is generally through clinical observation, particularly during known outbreaks, but of course muscle biopsy looking for cysts and eosinophilia can also help diagnose the infection. Treatment is difficult because most antiparasitics only attack the adults, so you would at least get rid of the adults and stop them from reproducing. But once the larvae have encysted in the muscle, it's really tricky to get rid of them because the antiparasitics don't really target the larvae, they only target the adults. So what you can do for patients who have severe inflammation is prescribe steroids to help reduce that inflammation.